Many patients are surprised when I ask them about their diet during the bladder consultation. The most important concept to understand is bladder symptoms are often driven by irritation and not infection. Diet for bladder health. What to eat, what to avoid, and why it matters. Why diet is often ignored. Many patients are surprised when I ask them about their diet during the bladder consultation. They often say, "Doctor, how can food affect my bladder?" But here is the truth. Bladder is one of the most diet-sensitive organ in the body. What we eat and drink directly changes the chemical composition of urine, and the urine is in constant contact with the bladder lining. So in this video, I'll explain why diet matters for bladder health, which food irritates the bladder, which foods calm it, how to identify personal triggers, and how dietary changes can significantly reduce urgency, frequency, burning, and pain. The most important concept to understand is bladder symptoms are often driven by irritation and not infection. Even when urine tests are normal, certain food can increase the bladder or urine acidity, stimulate bladder nerves, or worsen inflammation. This is why many patients notice flares after specific meals, even when reports are normal. So how food affects the bladder? The simple explanation to this is, when you eat or drink something, your kidneys filter the byproducts into the urine. That urine sits in the bladder. If the bladder lining is already sensitive, as in interstitial cystitis, bladder pain syndrome, chronic prostatitis, recurrent like symptoms, then certain substances in urine can trigger pain, urgency, or burning. So the bladder reacts not to the food itself, but to what food turns into in urine. So what are the common bladder irritants? Certain foods and drinks are known to irritate the bladder in many patients. The most common bladder irritants include caffeine, which can be coffee, tea, or any energy drinks, alcohol, carbonated beverages, spicy foods, citrus fruits and juices, tomato-based products, artificial sweeteners, and chocolate. These items increase the acidity or directly stimulate the bladder nerves. Patients often notice symptoms within hours of consuming them. Talking about caffeine, the biggest culprit. Caffeine deserves special attention. So how does caffeine affect? Caffeine increases the urine production, it stimulates the bladder contraction, and thus increases the urgency and frequency. Even small amount can trigger symptoms in the sensitive bladders. Switching from coffee to decaffeinated options or herbal alternatives often lead to dramatic improvement. This simple change helps many patients more than the medication. Talking about acidic foods and the bladder pain, acidic foods lower the urine pH, and the acidic irritates the bladder lining. The common acidic triggers include oranges, lemons, grapefruits, even tomatoes and sauces, and vinegar-based foods. These does not mean that these foods are bad. It means that they are not suitable for the bladder. Once symptoms improve, some patient can reintroduce them in moderation. So what foods are bladder friendly? There are certain bladder calming foods that are usually low acid, they're non-spicy, and they're minimally processed. So common bladder friendly options include plain water, milk or a plant-based milk, rice, oats, bread, or even eggs, and most of the vegetables of course, non-citrus fruits like bananas and pears, and lean protein. These foods produce neutral urine and thus reduce the irritation. Talking about hydration, it should be not too much or not too little. Hydration is critical, but balance matters. Too little water can concentrate urine and thus irritate the bladder. Also equally true is too much water increases the frequency and may worsen your urgency. The goal is consistent, moderate hydration. Urine should be either a transparent white or a pale yellow in color. Dark urine irritates the bladder, and the completely clear urine all day may indicate overdrinking. So what is the role of artificial sweeteners? Artificial sweeteners are a hidden trigger. Many patients switch to diet drinks thinking they are healthier, but the artificial sweeteners can trigger bladder lining and thus trigger urgency and pain. So what are artificial sweeteners? These include aspartame, saccharin, and sucralose. Natural sugars in moderation are often better tolerated than the artificial substitutes for bladder health. So how do you identify your personal triggers? No two bladders are same. What irritates one patient may be tolerated by the another. The best way to identify trigger is a bladder diary. So make a note of what you eat, note the timing of symptoms, and then look for the patterns. Eliminate one trigger at a time. Avoid doing everything at once. That becomes unsustainable and confusing. Talking about diet during a bladder flare. During the symptom flare-ups, the bladder needs rest. This is the time to simplify meals. Avoid all known irritants. Increase your soothing foods and maintain hydration. Once the symptom settles, food can be slowly reintroduced. Dietary control gives patients a sense of control during the flares. There are certain diet myths that can cause unnecessary restrictions. There are many myths online. You do not need to starve yourself, you do not need to avoid certain foods forever, or follow extreme diets. But the goal is bladder comfort and not bladder punishment. A flexible, informed approach works best for a long term. Now, diet as a part of broader treatment plan, what do you say? A diet alone may not cure the bladder condition, but it amplifies the treatment success, especially when it's combined with the correct diagnosis, bladder calming medication, pelvic floor therapy, and of course stress reduction. Dietary changes often make the difference between the persistent symptoms and meaningful improvement. Take home message. The most important message is your bladder listens to what you eat and drink. Dietary choices directly affect your urine, and the urine affect your bladder comfort. So by identifying the irritants, choosing bladder-friendly foods, and maintaining balanced hydration, patient can significantly reduce urgency, frequency, burning, and pain. Diet is not a restriction. It's a powerful tool for bladder healing. If you like this video, kindly share it with someone who needs it. Thank you.